Welcome everybody to the very first Informed Library Learning Series event. Today is our first Fireside chat, so thank you so much to everybody who has come in person and everybody who's viewing online. We're really excited about this. Big thanks to Red Deer Public Library for hosting us today. Big thanks to the Public Library Services branch of the Alberta government for providing us with the funds to be able to make this series possible. My name is Bryn. I am one of the directors on the Library Association of Alberta board, and we are presenting this series in partnership with TAL, the Alberta Library. And so we are going to get started in just a second here. I'm going to start us off with a land acknowledgement, and then I will introduce our speakers today. As part of our commitment to reconciliation, we acknowledge that we live, work, learn, and play on the traditional lands of the Treaty 6 First Nations, the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, and the Treaty 7 First Nations, the Blackfoot Confederacy, the Ganawa, Wagambi, and Siksika, as well as the Tsuut'ina Nation and Stoney Nakoda First Nation, and of the Métis people of Region 3. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our community. Sorry, I have things on my phone, so I just need to, to pull them up. So today we are very lucky to have Mary Graham and Becky Potter from Calgary Public Library doing their presentation about using debriefing tools to support frontline library staff. Mary Graham is a service delivery manager at Calgary Public Library at 3 community libraries in the city's northeast. She has worked in school, university, and special libraries, but has spent most of her career in her happy place, the public library. She has filled many roles at Calgary Public Library, including children's librarian, information services librarian, and a service design lead, and worked at many different locations within Calgary, including the Central Library in the inner city. When she is not at work, she can be found walking her dog, singing with a local choir, and parenting her 4 kids. Becky Potter is a library experience supervisor at the Central Library at Calgary Public Library. Her role focuses on supporting staff with safety and security, community partnerships, and library services for vulnerable Calgarians. Previous roles at Calgary Public Library include adult literacy and learning advocate, focusing on community partnerships and community outreach, and program coordinator delivering programs to community partners serving the vulnerable sector. Becky has worked on community initiatives including Financial Futures Collaborative, Calgary Poverty Reduction Initiative, and the Safe Communities Opportunity Resource Center. When she's not at work, Becky likes to spend time outdoors with her family camping, biking, and snowboarding. Welcome, Mary and Becky, and thank you so much.
Thank you. Oh. That would help if I turn this on. Thank you so much for having us today. We have done this presentation at a couple conferences, and we've done this presentation online to a few different library systems across Canada and the United States. But this is one of the first times that we're actually doing this live and in person in Alberta. So we're really happy to be sharing this with our Alberta colleagues today. So thank you so much for having us. I also want to start with a caveat that Becky and I are not experts. We are not experts in psychology or counseling or even in management, but what we're here to do today is to share our experiences working with frontline staff and the things that we have learned, mostly the hard way, about what the things that we can do. So we are not proposing a blueprint or a foolproof plan for any other library system to implement. What we're trying to do is share our experience so that you can maybe take some insight and ideas and make it work in your own context. So just want to start with that. So we'll tell you a little bit about our library system. For those of you who don't know Calgary Public Library, we have 23 locations across the city, which is a really large physical footprint. Calgary is a very spread out city. And these include 3,000, like really small libraries, 3,000-foot starter libraries, as well as, our 240,000 square foot central library and everything in between. And so we've got some photos of them here. We serve a population of about 1.6 million now in Calgary, and we're happy to say that over 800,000 of them are active library users. So last year we had over 7 million visits, circulation of about 11 million physical objects, and gosh, a lot of print jobs, 2.5 million print jobs. So just some of the highlights from our last year, as well as lots and lots of incidents. A lot of the work that we're going to talk about today originated in our central library, so I'll also give you a little bit of information about that. So there's a lovely picture of it there. So our central library was opened in 2018. It's an older area of Calgary, so actually one of the oldest areas of Calgary. It's an area that was quite run down over the 80s, 90s, and early 2000s, but has in the last 15 to 20 years experienced quite a rejuvenation. And the Central Library was part of that. But because of that, it does sit within close proximity to a lot of services for vulnerable people. And so our neighbor, you can't quite see it in this photo, but one of our neighbors is actually the Salvation Army Center of Hope, which is a transitional housing facility for around 300 men. So lots of, it's a very interesting neighborhood that we're in there. We have about 1 million visitors that come through there every year, and we serve both the surrounding area as well as the entire city. We have a lot of things that happen at the Central Library and our performance hall and other spaces that draw in people from all over the city. We also have some very specific and unique services there, like our Elders Guidance Circle, where people can meet with an Indigenous elder. So there's some services that people specifically come down there for. We have a lot of students, a lot of newcomers that come there, and families, but also a lot of vulnerable people that are coming to our central library too. We have, and there's just some photos of the interior here. At the Central Library, we have 120 full-time, part-time, and casual staff that work there out on the floor. And they're supported by a leadership team of about 10 people. And those are folks who are managers, assistant managers, librarians, and supervisors that oversee the operations and support the staff on a daily basis. So at any given time in this building, we have about 14 people that are out on the floor and a couple of supervisors that are supporting them. So the Central Library, more beautiful pictures of it, has always, because of where it is, and we were about a block, our old Central Library was about a block away from there, has always seen its fair share of challenging circumstances. Just being inner city in any city, you're going to see that. But we definitely have had ups and downs with that. But we certainly saw in COVID, a real increase in the number of incidents that we were experiencing there. And we, when we talk about incidents, I guess I should say too, that we mean anything that we need to document. So that could be anything from abusive language to a staff member, to someone who is intoxicated, to emergency situations where we have to call in first responders. So, and we've had, gosh, it was about 1,400 of those in the last year, I think. Yeah. So, so we've always had our fair share, but certainly since COVID, saw those on the uptick. So I'm going to pause it for there now, and I'm going to hand it over to Becky just to talk a little bit more about how we are approached it, handling these incidents and challenging situations.
Thanks, Mary. Yeah, so just to kind of set the stage, we'll talk a little bit about our customer service approach. This isn't going to be anything that's wildly different from probably what you're all doing in all your locations. Um, we recognize that customer service is really hard work. We know from our frontline staff, it's some of the hardest work out there, especially now, especially post-COVID. And so we just want to make sure that we're kind of, when we talk about how we train for customer service, that we train for our staff to work with patrons where they're at, recognizing that idea that everybody's got a story, a set of circumstances, a set of life events that happened that kind of led them to be wherever they are today, good or bad. We don't need to know what those circumstances are to kind of approach customer service with empathy and understanding. And so that's kind of our push, is to recognize that everybody has a story. And that we can approach those interactions and those customer service relationships with that kind of understanding and empathy as much as possible. But that also means that we have to manage behavior. And managing behavior in spaces is some of the hardest work that our staff do. It's an integral part of customer service, a necessary part of customer service, and it is such hard work. And so when we start talking about that, customer service approach, we recognize that hard work, managing those behaviors, it has an impact on our staff. It leads to stress. It leads to challenges with, leaving the stress of incidents at work and not bringing it home with you. It leads to things like burnout. It leads to leaves of absences. There's all sorts of things that happen when we recognize and we kind of realize how much work frontline staff are doing when it comes to like customer service and what that looks like in reality in public libraries especially. Yes, we have a code of conduct. You'll see a little bit of a snapshot on the side. I will say that we will share all our documents and stuff post presentation, so you guys will have access to the slides, the code of conduct, the debriefing document, all of that stuff if you want it. But yes, we have a code of conduct that we ask patrons to follow in our library. I'm sure every single one of you has something similar that governs the use of your spaces. And so we ask staff to enforce that, look at how they manage the behaviors of the people that are coming into our spaces. We're really lucky at the Central Library that we have a really great security team that works with our frontline staff to help support and manage patron behaviors. But it is still hard work. There's lots of stuff going on. So we know that repeated elevated situations impact staff resilience. We know that their responses to situations may be changed depending on how they're carrying their stress from previous incidents, and their ability to bounce back to what their baseline is. So whatever their normal is. We all have kind of a level, a baseline level of stress, anxiety, all of those things. We all have it, and it looks different for everyone. But we need to figure out how we get staff back to that base level of stress, anxiety, whatever it looks like, and that they're not carrying this extra level because of incidents that they're dealing with in libraries, in their work, in their day-to-day customer service work. And so that's kind of where we've been kind of looking at our customer service approach and how we support staff. I've given you a bit of background now around kind of that customer service lens. I'm going to hand it back over to Mary, and she is going to take us into how we got to debriefing specifically.
Yes, so a little bit of, going back in history. So take yourselves back to 2020 and pandemic, and in Calgary at the Central Library in particular, but I think at all our inner city libraries, we saw a really big impact in that, there was less activity happening in our downtown, people working from home, less people coming downtown to do activities. We also saw a real interruption in the supports for vulnerable people that were happening, the public health restrictions really interfered with that. So we saw a lot of social disorder that started happening in our downtown and inner city. Um, so as a result, we had a lot more incidents that were happening, but we also saw a difference in the quality of incidents. They were more serious incidents that were happening. They were requiring more staff time. They were more complex kinds of things, needing different kinds of emergency supports from first responders as well. So, excuse me. In the context of all of this, we just saw staff, more and more piling onto staff. And as Becky's talking about, they weren't able to like bounce back to baseline. Like things just kept piling on and on and on, big and small things. And, could feel that something was not quite right. But we're at a bit of a loss of, what are we going to do? We know something's, we know we need something, but what are we going to do? And then along comes a crisis, and there's nothing like a crisis to kind of force you into some kind of action. In our case, we had a critical incident at the Central Library in the summer of 2022. The details of this were not really shared in the media because of the nature of the incident, but I will just say plainly here, because it's not a secret, we had a public suicide that happened in our Central Library on a busy Wednesday afternoon. And this happened in full view of our staff and patrons, and it was devastating. And so, of course, in a crisis, all of the supports come out. We had emergency crisis counseling, we had our employee family assistance, we had even support from WCB forthcoming. All of those things were important and necessary, but in that reflection of dealing with something that was really, really terrible, we realized that our staff were already at such a high level of stress and duress that something like this, a critical incident, which is bound to happen at any time, just really threw us over the top and put us into a tailspin. And that's where we realized that we can't just keep saying, okay, we'll be okay. We'll just shake it off. It's fine. It's fine. It's fine. It wasn't fine anymore, and we had to do something differently. So we were really, I guess, fortunate in the wake of that we had a lot of support forthcoming. We had a lot of time for reflection and to think about how are we going to change things? How are we going to do things better in the future so that we don't find ourselves in this situation again? So as we were going through some of the post-incident training and reflection, we had a session from Calgary Counseling Center on de-escalation. And in this training, they talked about, and they just kind of in an offhand way said, yeah, after a difficult situation, you'll have some debriefing and then blah, 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 blah. Anyway, but Becky was in this training, and she kind of held on to that idea of debriefing and thought that this was something that really was missing from our process. We know that we all have times, when something bad happens, you come into the back room and you talk about it and things like that, but we really didn't have a process where we were supporting people after any kind of incidents, big or small. Sometimes it would happen, but if it was happening, it was like maybe really informal or haphazard at best, but a lot of times it just wasn't happening, and people were walking away without the support they needed after things that were happening to them at work. So with that, a project was born, and I will hand it over to Becky to talk a little bit more about the specifics of our debriefing process.
So, as Mary brought up, we were really fortunate to have the Calgary Counseling Center come out and talk to us about de-escalation and bring up some really important points around debriefing. We learned how important debriefing is in those sessions, and trying to, like Mary said, trying to formalize it and trying to make sure that there's purpose around it became something that felt like it would be impactful for staff. It felt like something we could do in the wake of something that happened that we didn't really have a lot of control over, and looking for different ways that we could support our staff. It felt like a tangible thing that we could do. So what we learned about debriefing was that we needed to give time for staff to process an incident within the workday. Not just saying, oh, they'll take it home and hopefully they'll talk to their mother or their sister or their brother or whoever. Actually talk about it during, as soon as we can after the incident. The idea being that we want the stress of of the day, staff stress, to be left at work. We don't want staff to bring this home. We don't want to have staff playing over the incident again and again in their head, thinking, I should have done this, I could have done this. We really want staff to be able to, as much as possible, shed some of that stress, leave it at work, and kind of establish those healthy work-life boundaries as much as possible. Again, this isn't a magic bullet. This isn't going to fix everything, but it is a piece that we can offer to support staff. And also the idea of preventing things from building up and affecting staff in maybe potentially more significant ways. Small incidents after small incident after small incident, some staff can roll through and there's very little impact for them. But those same incidents with someone else, depending on their life experience, their personal resilience, what they're coping with, and their own personal, mental health, there's a million things that can affect people's ability to deal with situations. And so we want to be able to kind of support staff with whatever they're dealing with at work that's causing them to be stressed, frustrated, and support those staff in the wake of any sort of incidents that are happening. We talked about the importance of returning to that baseline. You'll hear us say it again and again, because it is something that we really took away from the Calgary Counseling Center's advice, which was find a way to help staff shed that extra levels of stress, and look for that baseline and a way to return back to baseline. The other really important thing that maybe wasn't something that we had envisioned when we first started talking about debriefing, but it became quickly apparent that it was a great opportunity, was to help staff identify further supports. So debriefing isn't the thing that's going to solve all the problems and the magic fix. It is one piece of a hopefully multi-level system of care that staff have access to, whether it's through workplace supports, whether it's through family doctors, whether it's through separate counseling or whatever they might be accessing. But it's one piece of a multi-level system of support, but we recognize that we are able to nudge people into some of the supports that we already have access to through our workplace. So things like the employee family assistance program that we have access to. So telling staff about it, making sure that we give them the pamphlets, right, in a debrief, to make sure that staff are aware that this is something that they have access to. And potentially, WCB, and that would involve a connection with our human resources department, but depending on the nature and severity of what staff are disclosing in a debrief, it might actually be appropriate to connect them with our HR department and have further conversations around WCB. Okay, now we're going to talk about the document. Thanks, Bryn. So this is not great visually for you guys. I'm sure it's not great visually for the people who are streaming with us. This will be shared as a document for you guys to review after the fact. But what I want to say is it is a physical document that we created so staff had something to lean into. So it wasn't just like the concept of debriefing is important and please debrief with your staff, and we hope that that staff do that. We actually created an actual document when we were first piloting this. Everybody had this printed at their desks, and as soon as a staff member needed a debrief, we would grab the document and we would go and we would sit down and we would have the document to lean into to really try and frame the conversation, make sure there was purpose behind the conversation, and had guiding questions and things like that. Because it's not always easy to be the person asking the questions, right? To be the person who says, you look like you need to debrief, let's sit down and talk. Everybody, people work at libraries because they want to be helpers, right? You don't work at a library unless you want to help someone. And so a lot of times debriefing wasn't happening because, not because people didn't want to, but they just didn't really know where to start. They didn't know how to start and have that conversation, what questions to ask. So we were lucky enough, again, with the guidance of some of the training from Calgary Counseling, to be able to pull up, some questions, put some parameters around what a debrief is and what it is not. So debrief is a 5 to 15-minute conversation where we just talk to staff, ask what happened, how are you feeling, and very simple questions. The purpose of a debrief is to validate that a staff member did the best they could with the information they had. Sometimes that gets tricky because maybe a process wasn't followed. Maybe a procedure wasn't followed. Maybe there, as sometimes in management or supervisors, we're thinking like, oh, I think they could have avoided this if. A debrief is not the time for that. In the wake of an upsetting situation, there are not very many people who find it helpful to be told, did you know we have a policy? Did you know we have a procedure that you could have done or you should have done? For most people, that's not super helpful. Being told, being listened to, first of all, being asked, how are you feeling? And being told you did the best you could. Nobody goes out into an interaction and thinks like, I'm gonna wreck this. This is gonna go terribly and I'm here for it. Nobody does that. Every staff member entering into these, complex conversations is trying to make the best decisions they can. Sometimes it goes badly, sometimes incidents arise, and so just being told by someone, a colleague, a supervisor, a manager, you tried, you did the best you could, that's really powerful. So a debriefing is not a training session. Lots of times you will come up with information in a debrief and you're like, mental note or physical note, we're gonna follow up on this later. That's totally, has a lot of value. Training should happen at a later date. In our experience, that's been the most successful. Training within a debrief, it's no longer a debrief. Now that's just training. Who should be involved? Anybody. So you can debrief one-on-one. You can debrief in groups. One of the biggest things we want to do when we're debriefing is give back control. As much little things even. If someone comes to the back and needs a debrief, often we'll say to them, do you want to debrief right away or do you want to go grab some water? We're not giving them, this is not huge amounts of control, but little things. Oftentimes when incidents arise, some of the stressors or frustrations, part of it is that loss of control. That loss of sense of like, I thought we were doing this and the situation went totally a different way and you lost control of that. So any little bits of control we can give back. Where do you want to debrief? Do you want to debrief at this table over here? Or do you want to go to a room? For us, the only rule is that we cannot debrief in the public area for obvious reasons, right? So we want to be somewhere in the staff area where there's some level of privacy. But again, what kind of comfort staff have in where they want to debrief, that's kind of what we lean into. And so back to that, who should be involved, that's a control piece as well. So if you have two staff members and one is really frustrated with the other because they think that one didn't do what should have been done, maybe that's not a good situation for them to debrief together, or maybe it is. Maybe that's a conversation they need to have to understand different perspectives, to understand what information the other person had and why the situation rolled out the way it did. So again, giving control back. Did you guys want to debrief together? Would you like to debrief one-on-one? Those are easy ways to give control back into a situation and hopefully help staff start to kind of go back to their base level, return to that sense of, I'm back in control of the situation. I get to make some decisions now. The other little piece about debriefing for us is when we can debrief as soon as possible, that's important. We recognize, and when we talk about all the different libraries that we have in our system in Calgary, not all of our libraries obviously have the same level of staff. And so that becomes a little bit trickier. So I think Mary's got some stuff to say about that later. But just trying to debrief as soon as we can, recognizing that there's some constraints, like just logistical constraints on that is important as well. Let me see, did I cover it all? Yeah, so that's a brief review of the document, maybe not so brief, but a review of the document. We will share this out with you all. And so now I'm going to pass it over to Mary. A document is great, it's really great, but it's not everything. And so Mary's gonna talk about how to actually make debriefing work and what we had to do.
Thanks, Becky. So yeah, it was one thing to have a document, but it's another thing to try and make this work in the context of our daily work. So this work started at our central library, so that's where we piloted it. And we definitely needed to go through some iterations of this. We didn't get it right from the get-go. There was a few different changes that we needed to make along the way. So we did learn by doing, but we also made sure that this was a really intentional process, that we told staff, okay, we've got this process that we're trying out. We want to try this with you. We want some feedback, and let's see how it goes. Just so that they would know what we were doing and why. We also recognized that there were some things that made it more successful for us at the Central Library, and some things that we had to really establish that would be okay before we can make this kind of process work. One of them was permission to step away from the floor, and this was a big thing for us. And I could say, I guess, fortunately, in the wake of a critical incident, we had the ear of management and upper management to say, okay, staff are in a situation where they feel like they can't walk off the floor. They feel like there's not enough people there, that they're going to leave their colleagues in a lurch if they walk off the floor, or patrons aren't going to get service if they walk off the floor. So we did get some extra support with staffing, but nonetheless, we also had a shared understanding within our library leadership that staff mental health is important in the workplace, and that we're prioritizing this when it comes to incidents, and we do give staff permission to walk off the floor when they need to do that. So that was something that we discussed and negotiated, and again, we were lucky, not lucky, but I mean, we were fortunate that we had the ear of our upper management to really make that happen. We also really worked on making sure that everyone trusted the process. And that is both from a people leader, like management side, and also from the staff on the floor side. So letting staff walk away from the floor is a big deal, right? Because what are you doing? Why are you doing that? So recognizing that, again, staff looking after themselves and, being able to walk away to take care of themselves, process, talk to someone else was going to be something that we needed to give them the autonomy to do when they needed to do it, was something that we had to make sure that our managers and people leaders knew was something that they had to do. And I mean, and that's hard. That is hard, because sometimes you feel like, well, why are they walking off the floor? That wasn't a big deal. But again, trying to help all of us understand that, we don't know what impacts people. Something that looks very minor to us could have a big impact on others. Sometimes in our presentations, we've talked about how, some things that don't affect you one day can affect you very much another day. And a good example is at our central library, we have a lot of lost children. It just happens, like caregivers and kids get separated. So we deal with lost kids pretty much every day of the week. And so it is something pretty routine for our staff. But if you think about If you have a staff member who happened to have lost their child in a mall or something the day before, so, you know, like they've gone through that experience themselves, they come to work the next day, there's a lost child, they go back into that situation of the terror and everything that they felt for themselves personally. So something that didn't affect them one day after they've had this own experience themselves could really impact them. So we try and think about situations like that so that we know that different things on different days are going to affect people differently. We also had to work on our staff trusting this process too, because when you're really busy and you have a colleague that needs to step off the floor, that can also, you know, be hard because we want to share the work around, and we want to make sure that everyone is doing their job. But to know that sometimes it's important for excuse me, for people to take care of themselves, and that to know that it's okay if patrons have to wait a little bit longer for what they need because someone is taking care of themselves. Yeah, we had to get that message across to staff that were working on the floor, and I think we were pretty successful with that. We also needed to have buy-in from our leadership about providing debriefs. And again, we were in a situation at the Central Library where we had a leadership team who were really looking for ways to support staff in the wake of this incident. They were really feeling the need and feeling a little bit helpless about how they could support staff. So this was a really concrete way in which they could do that. So we had a lot of willingness from them to try this process out. So as we went through the process, we did have Becky, who was leading this, do a lot of the early debriefs with our staff. And she had other members of the leadership team sit in with her so that they could see the process happening and then would be able to learn by doing. So we did a lot of that kind of thing in the early days where people learned from shadowing in this process. And that was pretty effective. And I think that really built the confidence of the people that were providing debriefs. And as staff were going through this process too and experiencing it, that also made them more willing to trust this process as well, both for themselves and then also for others. And that was a really great thing to see that staff would not only start self-advocating for themselves, saying, hey, I've just had something rough, I need to walk off, I need a debrief, and then come to someone to ask for that, but they would also do it for their colleagues. And they would say, hey, you know, this looks like you've really had a really hard interaction here. Why don't you take a couple minutes and, you know, maybe you want to go to talk to someone in the back. Or, you know, if they didn't seem willing to do that, they would also contact a supervisor to say, hey, so-and-so has just had a really hard interaction. Maybe you want to check in with them and do a debrief. So as we did this more and more, we saw staff kind of really picking up on this process and advocating for themselves and others to do this. I think the next slide we have, oh yes. So we do have some tips about debriefing that we'll talk about. And we've done a few workshops where we've talked about this really specifically, and we found this really helpful to talk this through. So for people who are offering debriefs, it is a significant thing. And certainly when we've talked about this in our system, it's not always leaders or managers or supervisors that are providing the debriefs. It can be done between staff at any level. And certainly in our smaller locations, we need to have that happen in that way. So for those who are providing the debriefs, getting yourself in the right headspace is really important. So whatever you need to do, it's that concept of, you know, you're putting on your own oxygen mask before you're helping others, right? So, you know, like just take a moment, have a glass of water, deep breath, whatever it is that you need so that you're ready to be fully present for the person when you're doing the debrief. Having water and tissues available when you're debriefing, really important. We don't know what kind of we don't know what kind of emotions are going to come up in this situation, so just being prepared for anything. And also drinking water actually really helps with emotional regulation. It's something about the breathing and swallowing and things like that that actually help people to calm down, so it's a really good tip that we've learned along the way. Being prepared for awkwardness, for you know, laughter, embarrassment, pauses and silences, lots of silences too, right? And that can feel really awkward, and you think, oh, I need to fill this silence, I need to say something. But sometimes people just need a minute to process, and just holding space for them is really important too. So being prepared for that. As Becky was talking about too, not getting sucked into a training session. And very often we have found with people who are debriefing, they really want to talk about the things that went wrong, the things that they did wrong, or the things that someone else did wrong. And that is totally normal and totally natural. And it's okay to listen to that, but it's also, we want to make sure that we are not then piling onto that and saying, yeah, and they should have done this and they should have done that, and really getting into that problem solving, because this is not the place for it. There is a time for problem solving, and you can tell them that and just say, hey, you know, I hear what you're saying, and I'm going to take some notes about this, and we can follow up on this later, and I will ask you some more questions. But right now, I just really want to check in and make sure that you're okay. So really resisting that urge, because again, we are helpers, we are problem solvers, and so we want to do that, but that's not what this 5 to 15 minute conversation is about. And speaking of the 5 to 15 minute conversation, they really shouldn't be going longer than that, but there is a tendency sometimes for people to kind of get stuck into a repetition. So sometimes you need to have a wrap up prepared. Just so that if someone is starting to spiral into the same things, that you can say, okay, it sounds like we're going over the same things over and over again. I just want to make sure that you're able to kind of, you know, to set this aside. If this is still bothering you later, we can come back and have another conversation, or maybe it's something you want to talk to another professional about, and we've got employee family assistance, whatever those things are, but you don't want to turn this into an hour-long conversation, because that's not feasible for our workplaces, or it's not feasible, you know, for our own process, and we're not going to be helping the situation either by just drawing it out that way. So being prepared to do that, know that's not being unkind, it's actually being kind, and making sure that we are bridging to those other resources is really important, which I think is my next point. Being prepared to make referrals, so having your handouts, your cards, whatever it is, for the other supports that you might have available in your system is really important, because we are not, you know, people that are doing debriefs are not the professionals. We're not the ones that can really provide that support, and we need to make sure that we are setting boundaries around what we can do in this process. So having those ready, and then also, because this can be heavy work for a person that is doing debrief, being mindful of sometimes you'll need a debrief from a debrief. So having a trusted colleague, or a friend outside of work, or someone that you can kind of shed the impact of listening to things, even secondhand, can have an impact on you. So having a way to shed that from you as well is important in this process. So those are some of our tips. I'll just say also too about the process that we did at Calgary Public Library. Once we did this at the Central Library, we did then make some tweaks, and then we rolled it out across the system. I think it took us about 4 or 5 months to get it to where we could roll it out across the system. And we did that by having Becky go out to a lot of the staff meetings at our different locations and talking about the process. The debriefing document that we shared is posted on our SharePoint so that anyone can access that document. And we've really tried to emphasize that it is not just leadership staff that can do this, but it can be anyone who can debrief with anyone. So it is an expectation and an idea that all staff should be able to access and do this if needed. We have also integrated it into our other training that we do. So we've been doing this presentation for a couple of years now, and so as we've been doing this, we've added on more things in the training that we're doing at Calgary Public Library. So we now have a safety and security module that all of our staff do when they're entering the library. So we've talked about debriefing in that training. We have, I think we make reference to it in our onboarding training for all staff, at our Start Smart training that we do for all of our staff that are coming into the system. And we mention it in other trainings, like around psychological safety. We have training for engaging with vulnerable people. We make reference to that. So we talk about it in a lot of different areas, because that's something that's also really important too. with anything like this, with any process like this, you have to keep talking about it and having people engage with it, because it doesn't just happen automatically overnight. And especially with something like this, when it doesn't really come up until maybe you have a crisis. I mean, there was lots of things that were happening at the central library where we were needing to have this right away, but at some of our smaller locations, they might not have as many incidents. So weren't using this in the same way. So making sure that you are talking about it over and over again and integrating into as many different parts of your training and just culture of the library is really important. And I will hand it over to Becky to talk about some of the challenges that we had with implementing debriefing.
Thanks, Mary. As I'm sure you can all imagine, it was not without its challenges to kind of start this process. It was a little different at Central because we had, just experienced kind of a critical incident, and it was apparent that we, needed to support our staff. And so the leadership team at Central was, all in. They were ready to be involved in debriefs. They wanted to shadow. They were, the leadership team at Central was, was really supportive of it. The system as a whole was very supportive of it. But one of the challenges was for locations that have very few incidents, they thought it was, sure, great idea, but it's probably mostly not for us. It's mostly probably for Central. They have lots of incidents, so they'll need it, but it's probably not something that we'll need at our location. And understandably, right, it's easy to understand how you would think that way. What does become apparent is sometimes when things happen at locations that don't have a lot of incidents, sometimes the impact of that situation digs a little deeper for staff. It sticks with them maybe a little longer because it's maybe a bit more unexpected. At a location that has incidents very regularly, staff, unfortunately, at those locations, they are kind of trained to expect the unexpected, right? They're in it and they're looking at when is it going to happen, where is it going to happen, how is it going to happen, but it's going to happen. They're ready for it. At other locations, when they don't have very many incidents, staff are, in some cases, caught a little bit off guard. And those surprising incidents, things that you never see coming, sometimes those hit a little deeper. So initially, buy-in from locations with very few incidents, it took a little longer. That definitely was a challenge. The big, question of like, whoa. I am not qualified to be anybody's therapist. Fair. But we are not asking anybody to be a counselor or a therapist or to be anything that you're not qualified to do. This is a human conversation, a human interaction where we check in with one another and say, hey, that looked like that was hard. Tell me what happened. Tell me how you're feeling. You did the best you could with the information you had. You don't need a degree for that. That's a conversation to support, a coworker. And sometimes that lateral support, so Mary mentioned that you don't always, doesn't have to be a manager or a supervisor debriefing with a staff member. And sometimes the lateral support is, in some cases, more powerful, right? You have someone who's in it with you, right? They're out there on the front lines, having those conversations, dealing with, difficult interactions, having, the same experiences, and having someone who's in it with you say, you did the best you could. I can see how you might have made that choice. Like that, that's a tough one. Just checking in to make sure you're okay. That, in some cases, means more. So am I qualified to do this? Again, one piece of a multi-level system of care that hopefully people have access to. This is just something that we can immediately do to say, like, let's check in. It is not meant to replace, professional mental health help. It's not meant to be a counseling session. So it is and then kind of support not instead of. Who to involve. So this one was really interesting at Central because, like I said, we had like lots of the leadership team was very eager, like, yes, we're in it, we're going to support staff. And in some cases, we did too much. Too many people were involved. There were too many check-ins. There was too much. And so staff who were involved in an incident were now bombarded with, multiple people checking in. And it became quickly apparent to us that we needed to coordinate, right? We needed to get organized and coordinate. And it couldn't just be everybody who was very well-meaning and very well-intentioned, just like, I'm checking in, like, I'm going to check in, I'm going to check in. That's all well and good, but it's overwhelming, or it can be overwhelming. So we had to get organized, and we had to really decide who's debriefing with this person, who else needs to be involved. In situations where maybe there's a police report that needs to be filed, we would deal with that in a different way because different levels of staff need to be involved. So we had to coordinate. We had to understand what was going on. And so that was definitely a challenge in the beginning. Another thing that was quite interesting in the beginning, it's like a Genesis story in the beginning. In the beginning, though, it was quite interesting that staff didn't necessarily recognize the need in themselves. So they would have an incident, an interaction, and they would just try and keep, going on the floor. And what we saw happening was their coworkers say, hey, that looked like that was really hard. Why don't you step off the floor and take a minute? For a lot of people, it's hard to ask for help. Like to put your hand up and be like, I need a minute, I need a timeout, I need to step off the floor. For some people, that feels like asking for help. That's a hard thing to do for a lot of people. And so what we did see, like I was saying, is staff seeing it in their coworkers, looking out for each other. And that was something that was interesting because it became really apparent, and it's not something we didn't know, but it was very apparent that, staff have been looking for a way to support each other, and as they always do. And this was a tangible, logical way to say, like, ooh, I know what to do here. Like, you need to step off the floor. Maybe you need a debrief. Tag someone to check in to say, hey, I think so-and-so might need a debrief. So it was something so that, people felt like they could take action, that they weren't just saying, like, oh, geez, like, someone needs to check on them, and I don't know how to do it. And because we've been able to formalize the process and even name it, right? Even saying so-and-so needs a debrief, everybody knows what that means. Before we had, this process, we didn't really have a way to name it, right? It was like, oh, could someone check in on so-and-so? And again, we were doing it, in a very unstructured way. So the challenge was, that staff weren't recognizing it in themselves, but the more that staff have been nudging each other, now we're actually seeing staff start to recognize it in themselves. That it doesn't feel as awkward to say, I need to step off the floor for a minute, which is a total positive from our point of view. Having a workplace culture where staff feel like they can own it and say, that was hard, I need to step off the floor. That's what we're going for. So these are challenges. I got to do the challenges. Mary's going to talk about some successes. And then I think we've got some questions.
Yes, and I'm just going to say too that even people who are regular practitioners of debriefing sometimes need that nudge and reminder because we had another critical incident. And sorry, I'm throwing you under the bus, Becky, but we did have another critical incident this fall at the Central Library. I don't work at the Central Library anymore, but I do remember messaging Becky and saying, okay, so when do you need a debrief? And, got a haha, yeah, no, it's all fine, I'm fine, everything's good. And then saying about a couple hours later, okay, so when are we going to debrief, Becky? So And we eventually did that debrief. But I mean, it happens at all levels that people sometimes need that nudge, right? And especially people who are used to taking care of everything and being okay in the face of everything, sometimes need that reminder. So anyway, so we have had lots of successes with this. We've been working with this document now for 3 years in various forms, and we have really seen a positive impact. Like we've been talking about, it really has become a part of the culture, the way we're handling things. We've really seen that it's a tangible way for people to be supporting each other, for people leaders especially, to support staff on a daily basis. I know in my locations, I do see this happening regularly. Yeah, like as recently as last week, yeah, I sat down with the staff to debrief after, not something that was big, but, just like, are you okay? Tell me what happened. And having that conversation, it just becomes part of what we do. It's also been really great in that it helps us to identify more efficiently who might need some help. So when we're sitting down with people and talking with them and hearing what's happened with them, and maybe even hearing more about what's going on with them outside of work, that helps us to kind of flag, okay, this might be someone who needs a little bit more support with other things. And so we're also able to bridge them to that support or have more ongoing conversations with them. So it's really, I think, helped to open up some of those conversations about mental health and accessing help in our workplace. We have definitely seen staff advocating for themselves, asking for debriefs. But I think the really significant thing too is that other people are saying, hey, you need to debrief. Why don't you go off the floor? I think that's one of the biggest successes that we've seen. And I know there was a couple of years ago that Becky and I were doing an interview with a staffer position that we had at the Central Library, and that we were asking about a challenging situation that the staff member had faced, and as a part of one of the questions. And she happened to mention to us too, after this happened, everything was fine. I felt fine. But one of my colleagues said to me, hey, why don't you go to the back and just, maybe talk to one of the supervisors and have a debrief. And she thought, oh, I don't need to do that. But she decided, okay, I'll do that. And she said after she had done that, even though she didn't really think she needed it, she actually felt lighter. That's how she described it. She felt lighter. And it was just easier just to walk away from work that day. And so that was really what we were trying to achieve with this, was for staff not to carry all these burdens with them, take them away from work. And so that, to us, was kind of proof positive that this was having the impact that we wanted to have. And we didn't ask her for this, and she didn't know that we were doing presentations about it or anything. It was just something that she just happened to volunteer. So I think those are some of the big things. And yeah, I think that we have really been learning and adapting this whole process as we go. I think as late as last June, we had made some adjustments to the document because we had some more training actually from, I think it was the Calgary Centre for Sexuality, around boundaries. And they had a model for debriefing that we thought was really helpful too. So we've added that in to our document as well. So this is a living document. It's not something that has stayed the same for 3 years, but we keep adapting and we keep working on it. So I think that it's been quite successful, and I think it's made a big difference in our workplace. So that's that. And I think with that, we will open it up to questions from the room and from online.
My question is just around staff members that, let's say there's a particularly traumatizing for them incident and they just want to go home. Do you try to have that debrief with them before they go home? Like you talked about not letting them ruminate and live it over and over in their mind, but they're not at a state where they want to talk to anyone, they're crying. I've had an incident like that. Or is it better to just say, that's what you need right now, you go home and we'll talk about it first thing when they come in the next day?
So what I would say is
the employee, the staff member always has agency, right? So as much as we want our team to, you know, if someone identifies that maybe they need a debrief or we offer it, we would like them to take us up on it, but we can't force the issue. So I jokingly say that if they don't want to debrief, then they can listen to me talk about why debriefing is important for 5 minutes. And if they still don't want to debrief, then that's fine. But I think it's about framing the conversation, giving them information about what debriefing is and what it isn't. In some instances, staff don't want to participate in a conversation where they're going to be told what they should have done differently because they're not ready to hear that. And so if they don't understand what a debrief is in your context, in our context, then it's up to us to explain it to them in a way that maybe gives them, you know, a framework of what a debriefing is, what we would talk about if you choose to have this conversation, and get buy-in. If they're not interested, if they're just like done, that's really hard. You can't force that. But I would suggest that maybe the next time they come in, the next shift, it would be important to check in with them at the beginning of that shift. And depending on like what your policies are, relationship with the individual, maybe even a call, you know, if they have a few days before their next shift, it might even be appropriate to reach out to them, you know, at home and just say, hey, I'm just checking in, wanted to see if, you know, how you're doing. That would be, I don't know, that would be my approach, I think. Mary has nothing to add.
There was also a question online just to confirm the stats for your incidents and what the timeline was.
The stats were 2025, so for the whole year.
Mm-hmm.
And
was it 1,400?
Oh, sorry.
1288.
Oh, sorry, I was thinking baby. I was just updating stats yesterday, so, yeah.
Specific.
That's just central.
Yes, central, yeah.
And it might be 14
2441.
for the whole system.
Yeah.
And that's everything from like our whole gamut.
So a follow-up question for that is, what do you define as an incident? Sometimes I find that like my staff are inundated with like a bunch of like little things that they don't want to report it. It's just like, oh, I just got called a bitch today. Like it's nothing. So just kind of like, where do you guys draw the line? What is the threshold for what are you reporting versus what are we letting slide?
So is this in relation to the actual stats of the incident reports, or is this in relation to a debriefing? Is that what the question is?
I would say more about the incident report.
Okay. So our incident reports track everything from abuse, aggressive, violent interactions, all of that, up to threats included. And then it would also be banned patron re-entries into the library, things of that nature. Banned patron reinstatements, I think, might be part of this 2441 metric. I could double check with our security advisor and just double check what he gave us. But yeah.
But I think, like in terms of what we are reporting, it's really going to depend on context, right? Because yeah, there are some things where it's just not worth, you know, like I have a lot of teens in my location, and you know, like yeah, we have some interactions with them. Sometimes we just have to say, okay, you're gone for the day. We're not necessarily doing an incident report for that, but yeah, so it really depends on the context of how serious it is and whether we need to document it for further action later, whether we're going to put it actually into an incident report.
There is another one online. It just says, do you do staff engagement surveys? And if you do, have you seen a difference since implementing debriefing?
We do have staff engagement surveys. I don't know that we haven't asked specifically around this. certainly staff security and safety have been top of mind. And, you know, we've been asking questions around that, and certainly we've had some concerns from staff around that over the last few years, for sure. Whether we've seen like an improvement that way, I don't know, I'm not sure, and it's hard to kind of correlate, so I mean, so I don't have any hard, I'm gonna say I don't have any hard, like data for that. And as my kids would say, I'm mostly going on a vibes, kind of situation, but what I can say, and I mean, joking aside, in the last 3 years, I've worked in, because I've moved around quite a bit, I've worked in 7 different locations. So I know that we are using this protocol, and I know what the impact that it's having. So, so I can say from that perspective that I know that it is helping staff in dealing with things. So, yeah, but I wish I could say that, oh, here's the data, but I think, I don't think we have anything that we can really correlate to this. But I would say from the days of 2022, and I think Becky and Bryn would also say, like, from the time of 2022, when we were all feeling like that things were getting from bad to worse and we didn't see a way out of it, I think we as a system feel a whole lot better about how we're handling incidents than we did back then. Yeah.
I'm hoping I can ask 2 questions. You spoke about permission to leave the floor, and it is hard. People don't want to leave their coworkers. It's busy. Is there a difference between leaving the floor and going for a debrief, and leaving the floor and going to a staff space and just catching your breath alone? Is that something that you also encourage, or is it if you're leaving the floor, you're going to see someone for a debrief?
I don't think that we're really making a distinction. I would say in my locations where I don't think we're making a distinction on that. I think that if we're noticing that that's happening, we're trying to catch those staff and you know it's do some kind of intervention and offering debrief. But I don't think, and in the messaging to our staff around the system, I don't think we've really made a distinction on that. It's that, you know, you can take some time away to take care of yourself, and we're going to support you in that. And part of that support is going to be debriefing, but we don't say that you have to engage in that in order to be off the floor.
Excellent. Can I do a second question?
The only thing I would add to that is typically staff having the permission to go back of house or off the floor to a staff area, is that's the first step. And then being able to offer a debrief is potentially the next step, but like I was saying before, they have to be willing. So at the very least, they get a minute to collect themselves off the floor, and hopefully we get a chance to have a meaningful debrief with a little structure, to just reinforce, right, that looked like it was hard. How are you feeling? You did the best you could with the information you had.
My second question is if debriefs are documented, because I'm thinking, you know, if Becky has 5 debriefs in 2 weeks, then we really should be paying attention to what her needs are, and if we're looking at having to provide more support, because it's been a bad couple weeks.
So we made a conscious decision at the beginning to not document it. We don't keep stats on debriefs. So I would love to sit here and say like, oh, we've done 222 and like they've all been so successful and here's the outcomes. But we don't have that, and for a couple reasons. One was we didn't want it to be super process heavy. We felt like that might be it might add that extra layer where people stop utilizing it if it's super process heavy. And the other piece is that anonymity and privacy. And obviously there's ways to keep track while preserving people's, privacy. But we chose not to do that. So we don't track, we don't stick count, we don't do anything as far as tracking debriefings at this point, yeah. But anecdotally, what we would do is, like Mary was talking about the vibes, not exactly that, but, you know, we will talk to other supervisors. So our team at Central, for instance, we have, you know, 10 supervisors, between supervisors and librarians, you know, and we would talk amongst each other and maybe just say, you know, so-and-so had a hard incident yesterday, like maybe just check in with them tomorrow, or, you know, they're in tomorrow, maybe check in with them. If that same person has, you know, an incident that day as well, we would maybe adjust accordingly, right? Have a conversation with them. What do you need? Do we need to, you know, do we need to alter and make sure you're in different spaces, or things like that? Like, to a point, we can accommodate, and we do the best that we can with that kind of information.
Yeah, I guess I would say, and I manage 3 locations, and I guess I would say I'm hoping that I would know from my leadership teams if there's things going on, that they're connected in enough with staff, that, you know, if there's something that's, you know, someone's going through a rough patch like that we would know and be able to follow up. But yeah, it is really, for us, it's a really informal process.
Hi. I'm just wondering if you have any suggestions for us smaller libraries where sometimes we work alone and there's no one to debrief with.
Yeah, for sure. So, and I have a couple locations where I just have 2 people that are on site at times. So, so that is a thing, right? Like you can't necessarily like just stop all service to the public to do your debrief. So we have had to get creative, and that can mean sometimes we use Microsoft Teams and we can do a debrief over Teams. You know, certainly I know Becky's done that with people from other locations who have given her a call to do that, or we can do it over the phone. We've also had express support from our administration for staff staying late to do these kinds of things too, again, in their commitment to support staff wellness, that, you know, we can pay them overtime in order to get this done after hours if that's what it takes, you know, or we do it the next day, or whatever is going to work. But yeah, we do make sure that that there's some way, but yeah, working in small locations can be a real challenge. So that's some of the ways that we've gotten around it.
Hi there, I just had a follow-up question actually to that ladies over there. In the very small locations where there are a few people, is the leadership team supportive of the library being closed for like 10 minutes?
Well, that's an interesting question, and like I have 2 really small locations that we've never had to close for this kind of thing, and so I've never had to test that out, actually, to be honest.
I do oversee a very small library location which supports about 20,000 people,
Oh, wow.
which is not big enough for that community.
Mm.
And that is something I will say to them, like,
Yeah.
just shut the door.
Yeah.
Because
Yeah.
there is only 2 of you.
Right.
So I'm just wondering if
Yeah.
the Calgary Public Library would be supportive of that.
Yeah, I'm not sure, and I don't want to speak. Because it hasn't happened. I don't want to
Yep.
speak for my bosses, but certainly, you know, I think in some of those situations like that might be the only option that you have, right? So yeah.
We have an online question or a statement. Tilly agrees that nobody who has experienced abuse or traumatic events on a shift needs to hear what they should have or could have done differently. But is there a complementary process to address this?
So for us, it would be a bit of a conversation with the individual too, right? So if we're identifying things in a debrief that are things that we should definitely follow up on, we would, you know, be trying to think about like when's their next shift, right? And we wouldn't be having that conversation that same day. Even if this debrief happened at the beginning of their shift, we're not going to do a training meeting at the end of their shift. We're going to wait for a different day, and we're going to have a conversation, and approach it in a positive way, right? I just wanted to follow up on, you know, some things that came up when we were debriefing about this incident. You know, I'd like to spend some time talking about it. You know, do you think today, like, do you feel like talking about that today? Would that be a good time? Again, being kind of respectful that maybe they're still struggling with that. It's a good time to check in as well, right? If they're like, no, I don't want to talk about that today, well, that's a bit of a clue to you that maybe they're not fully, past this situation. Maybe we need to take some care and have a follow-up, conversation, debrief, divert them into other supports that might be available. So there's lots of different avenues, I guess. Part of it is going to be, you're going to be judging based on how critical is it that you address this potential training gap, or this, piece of information that maybe we need to follow up on. If it's super critical that they didn't understand this, really important piece of policy that they needed to follow, you might have to, make some hard decisions around what that next meeting looks like. Maybe it has to be before they start their shift again. For the most part, though, we haven't found ourselves in any of those kinds of, critical follow-up type scenarios. It's mostly around things around like maybe proximity, right? Like not being too close to people, worrying about your own personal space, right? When incidents escalate, and making sure that you're, not within the 6 feet, making sure you're backing off, things like that, so that things maybe don't escalate in a way that hopefully they shouldn't. So it's mostly those types of follow-ups that we're doing. It's not so much around like critical policy. Most of that stuff is fairly taken care of.
And I'll just add to that too. I think with my process, with my teams, like some of that's going to come up, like maybe in their one-on-one meetings that they have with their own supervisor, we can have it there. But also, if something's come up like this, that sometimes I'm like, oh, I think we probably need, if one person has had a struggle with this, maybe there's going to be more people that have that issue. So maybe it's time for us to review the procedure around this or that kind of thing. So then I will do something to make sure that all of my shift supervisors know what they need to know, or all of my teams know what they need to know around that. So it's just a good reminder for some of those processes too. So we don't always have to be necessarily like pointing the finger at the specific person as well.
So I have another question. So specifically around resources and that you provide for staff. So I'm just wondering, do you guys pay for an additional resource for all staff, or is it something that maybe just full-time or benefited staff have access to? I know like in my library, full-time staff have benefits, so therefore they have access to resources through that, but we don't have anything additional for, say, part-time staff.
Yeah, for us, we're lucky that all of our staff from the day that they're hired have access to our Employee Family Assistance Program. That has limitations on it, of course, in terms of like the number of sessions and things that they can access, but yeah, they are not limited to like just full-time people. But even if you don't have that, it's just important to know what supports are out there. And for us in Calgary, we have things like the Distress Center. We have, yes, we've got some of the like community mental health, and we even partner with one of those organizations to provide our own wellness desk in the library for patrons, and so we've got that support too that we could offer to our staff as well. So knowing what the resources are that you have, I think is important. We're just lucky that we are resourced with that, but knowing what you've got is, I think, important, so that you're not scrambling to look for that in the moment where you need to offer it.
Hi. So you had said one of your tips was to like be prepared with a way to wrap up your debriefing conversation. Would you be able to elaborate a bit more on that and like ways that you are typically wrapping the convo up? Because I could see how that might be difficult sometimes.
Yeah, so I think just saying something, like just saying, okay, so if they're starting to repeat themselves, just saying, I think we're going over the same thing over and over again. So I think I want to leave it there for today. And we can, if you're still wanting to talk about this in your next shift or tomorrow, whatever it is, we can talk a little bit more. But something like that, I think is helpful. Just for general wrap up, I think it's, you know, again, that bridging, like, you know, like thanking them for sharing and letting them know that there's other resources. You know, if you're still thinking about this, you know, later tonight or tomorrow, that, you know, you may need to talk to someone else. So bridging to those resources in that way too. Anything else?
One thing I would recommend, especially when you're first starting to debrief, is really when you sit down, using whatever document. For us, we use our document, and we really frame the conversation right from the beginning. So talk about what we're doing. We're sitting down, we're gonna debrief. This should last about 5 to 15 minutes. So you're already giving them information about what you're there to do, what the constraints are, right? Telling them that this isn't like, you are not a, you know, mental health professional, but you just want to check in and debrief with them around this really hard thing that happened. Because then if it starts to go on too long, you've already framed the conversation. So you can lean back into the document, you can lean back in to say, like, you know what, like, it sounds like this is really hard. And I really sympathize with what you're feeling and what you're going through. Let's talk about the other resources that are way better equipped to support you than me. Because you've already framed about, you know, what you can't do. You are not a professional counselor. You're not supposed to be. So yeah, just leaning back into the document. And so sometimes you have to put in the work up front to frame the conversation so that on your wrap up, you can kind of lean back into that. Thank you.
I'll lean into the silence.
All right, thank you so much, Mary and Becky. I even learned some things, and I've been through this before. So thank you so much. We were honored to have you come and do this for us. And thank you all for coming, everybody who came in person, everybody who attended online. I did want to, as a wrap up, let you know about the other sessions that are happening in this series. So the next session is on March 10th, same time, 1 o'clock. And this one will be on persuasive leadership. And it will be held in Edmonton at the Mutart Hall at their central library. At the Stanley Milner Library. And so that one, again, is free. You can attend in person or online. Then coming up in April, on Thursday, April 16th, the day before the Southern Alberta Libraries Conference in Lethbridge, we are bringing in James Turk for a full day session on intellectual freedom, and specifically around how to have conversations with community members about intellectual freedom and also support with intellectual freedom policy. There is free lunch, and it is a full day session, so it's free too. Like, I don't know how you can get better than that. You just have to make the trip down to Lethbridge. And then our final event for this year is on Friday, May 8th, at 1 o'clock, again, online and in person in Calgary, at the Patricia Whelan Performance Hall in our central library, and it will be about fundraising. And so these are all on our Eventbrite. They're all free, supported by a grant from the Public Libraries Services branch of the Alberta government. And so we hope that you can join us for some of those. Right, thanks. Here in person, we have this room for another like half an hour if you want to chat and get some coffee and stuff.